Can smoking too much weed actually make you physically sick, like vomiting? Have you ever heard of scromiting? Scromiting is a mashup of screaming and vomiting, both of which occur in people who take too much cannabis. It's called the cannabinoid hyperemesis syndrome, which is just proof that we have to come up with a fancy name with lots of technical words to describe what has been known on the internet as scromiting. People screaming in intestinal pain, chronic queasiness, and a tendency to vomit. So they end up coming to the emergency department. Often the anti-nauseant medications that we give for people who are having vomiting from other reasons, chemotherapy or from gastroenteritis, don't work quite as well. Well, we know that there's cannabinoid receptors both in the brain, in the vomit center of the brain, in the gastrointestinal tract. So it's having a direct pharmacological effect. In addition, there may be other factors that are going on, the sweating, maybe activation of the vagus nerve system. And generally speaking, it's uncanny how often patients don't make the connection between their marijuana use and having cannabinoid hyperemesis syndrome. It's from daily, frequent, high-dose use. And really, the most effective cure is to stop using cannabis or to scale it down to a level where you're not getting vomiting and screaming. Some of the treatments that work, one home remedy that works very well is to take hot showers, seem to activate the hypothalamus, and that helps reduce the vomiting and intestinal cramps. And some patients will discover that on their own, and some we have to tell them that. Another treatment that will work is smearing capsaicin cream, which is a cream that reduces substance P, seems to be directly involved in the development of cannabinoid vomiting. So you smear it on the soft part of your wrist or on your abdominal wall. Make sure that when you're doing the smearing that you wear disposable gloves. Smear it on and then get rid of the gloves and wash your hands, because if you touch your mucous membranes, the inside of your nose, your mouth, or eyes, you'll never forget it. It will cause horrible, horrible stinging, and you'll hate that. There are anti-nauseant medications that will work in the emergency department. Haloperidol in low dose is often very effective, but we'll try the others. We'll try Gravol, we'll try Zofran, or ondansetron and some of the others, but often you need to go to these second or third order anti-nauseant medications. But the most effective treatment for scromiting is to stop taking cannabis. If you get off of it, then you'll find that slowly it'll go away, but it doesn't go away quickly or immediately.